Now for the latest on COVID-19. Healthcare experts from the greater Rochester area are weighing in on the less restrictive COVID-19 guidelines announced by the Center for Disease Control and Prevention yesterday. Alex Love joins us from the newsroom to explain how our community should take in this new information. Alex.
Well, Teresa, the CDC and local medical personnel emphasize by this announcement the pandemic is not over, but we have more tools putting us in a stronger place today to switch our focus to reducing severe disease from COVID-19 with fewer restrictions based on community levels. No matter your vaccination status, the CDC no longer recommends those who come in close contact of people with the coronavirus to quarantine, but should get tested within 5 days. Also, contact tracing should only be done in high-risk groups like hospitals or nursing homes.
If you're exposed, even if you're unvaccinated, they ask that you wear a mask, but there is no requirement, as there had been previously, to stay out of the community if you're unvaccinated. They're no longer as focused on the social distancing 6 feet apart.
Those who test positive for COVID are still required to quarantine for 5 days. Then you can go out in public while wearing a mask for another 5 days if you feel symptom-free. Schools also don't need to practice test to stay anymore.
Still benefiting folks to not be stuck at home for 10 days. So right now, if you're 5 days into your illness and you're afebrile for 24 hours, your symptoms are improved, you can go back into the community wearing a mask.
Data from the CDC shows Monroe and all neighboring counties have low COVID community rates. Even with new cases popping up, fewer are leading to hospitalizations. So local healthcare providers believe it's appropriate to adapt these new guidelines.
We have high levels of either vaccine or infection-induced immunity. So our community, for the most part, you've had COVID or you've been vaccinated. If you do get COVID, you have options for treatment as well. You have the ability to get an monoclonal antibody, or most recently Paxlovid, which is an antiviral.
Research has shown that more recently people can experience rebound symptoms, which is when you come out of quarantine but experience serious illness in the near future again from catching COVID. If so, talk to your doctor and start quarantining again.